What if I told you there's a simple 1-minute test that could reveal your risk of a heart attack without any blood tests, no hospital visits, and no fancy equipment? Hi, I'm Dr. Burk, and in this video, I'll show you a science-backed way to check how well your heart recovers from stress, and more importantly, how to avoid a heart attack before it ever happens. Most people focus on how hard their heart can work, but today we're going to focus on something even more important, how fast it can recover. Let's get into it. Every 40 seconds, someone has a heart attack. And in many cases, there were no obvious warning signs before it happened. That's why heart health isn't just about managing symptoms, it's about early detection and prevention. The good news? Your body is constantly giving you clues. One of the most overlooked yet powerful indicators of cardiovascular health is how quickly your heart can recover after physical stress. Most people measure fitness by how fast, strong, or intense they can perform. But the real question is, can your heart calm down just as quickly as it ramps up? This 1-minute test helps you assess the strength of your autonomic nervous system, the balance between stress and recovery, and that balance plays a critical role in how to avoid a heart attack. It's like checking your heart's brake system. If it doesn't respond well, your risk increases, even if you feel normal. Let's break down how the test works. Part 2. The 1-minute heart recovery test. Now let's walk through the test step by step. It takes just 3 minutes in total, and all you need is a stopwatch and your fingers. Step 1. Measure your resting pulse. Sit down and relax for 2 minutes. Then place 2 fingers on your wrist or the side of your neck. Count your heartbeats for a full 60 seconds. This is your resting heart rate. The average is about 72 beats per minute, but your number may vary. Step 2. Do 1 minute of intense movement. Perform any full-body exercise, jumping jacks, squat jumps, or even fast high knees. Go at about 70 to 80% of your max effort, enough to get your heart pumping, but not to exhaustion. Step 3. Measure your heart rate again, peak pulse. Immediately after you stop, count your pulse again for 60 seconds. This is your peak pulse, the highest your heart rate climbs. Step 4. Rest for 1 minute, then measure again. Sit calmly for exactly 1 minute. Then measure your pulse one more time. This is your recovery pulse. Final step. Do the math. Take your peak pulse and subtract your recovery pulse. Peak minus recovery equals your heart rate drop. This number tells us how efficiently your heart resets after stress, a crucial marker in predicting your cardiovascular risk. Part 3. Interpreting your results. Now that you've done the math, let's see what your number means. Heart rate drop, peak, recovery. Risk level. Less than 12 beats per minute, red, high risk, poor heart recovery. 13 through 20 BPM, orange, moderate risk, needs attention. 21 through 40 plus BPM, green, healthy heart, strong recovery. Over 50 BPM, muscle, excellent, athletic recovery. So, what does it mean if your heart rate only drops by, say, 10 beats in 1 minute? That indicates low parasympathetic activity, the system responsible for calming your heart after stress. And when that system is weak, it's a red flag for poor heart resilience. In multiple studies, including data from the Framingham Heart Study, a low recovery rate has been directly linked to higher rates of sudden cardiac death and myocardial infarction. But don't panic, this is not a final diagnosis. It's a wake-up call. Your body just gave you a valuable signal. The question now is, what will you do with it? Let's explore the science behind why this test works and why it's so important for your long-term heart health. Part 5. Drug treatment isn't enough. Let's get real for a moment. Modern medicine has made incredible strides in myocardial infarction drug treatment. Medications like beta blockers, ACE inhibitors, statins, and anticoagulants are critical, especially after a heart attack. But here's the truth no one talks about enough. Drugs manage the damage. They don't prevent the danger. Most people start taking these medications after they've already had a heart attack. But what if you could avoid ever reaching that point? That's where this recovery test becomes so powerful. It gives you a real-time, at-home indicator of how well your cardiovascular system handles and recovers from stress. It's a proactive tool, not a reactive treatment. Think of it this way. Drug therapy is the fire extinguisher. Heart recovery training is fire prevention. If your results show a weak recovery, it doesn't mean you need pills immediately. It means your body is asking for lifestyle intervention now, before you need those prescriptions. So how do we train your heart to recover better and truly avoid a heart attack? Let's look at what works. Part 4. The science behind recovery. Your heart is controlled by two branches of your autonomic nervous system, and both play very different roles. The sympathetic nervous system. This is your fight or flight mode. It kicks in during exercise or stress, speeding up your heart, raising your blood pressure, and pushing your body to perform. The parasympathetic nervous system. This is the rest and digest mode. It slows your heart rate, lowers blood pressure, and helps your body recover. Now, here's the key insight. A healthy heart doesn't just respond to stress, it knows how to come back down fast and efficiently. That ability to recover is driven by your parasympathetic strength. If your recovery is slow, it means your heart is staying in a prolonged stressed state. Over time, this constant tension wears down your cardiovascular system, increasing your chances of hypertension, arrhythmia, or even a heart attack. That's why this 1-minute recovery test is more than a fitness gimmick. It's a direct window into how resilient your heart really is. And the best part? You can train and improve it. Let's move on to how.